We're going to begin with an introduction to the spirometer and the components of OmniFlow. OmniFlow is a laptop computer that is attached to a digital spirometer, which is going to measure the volume and flow of air. It also has components that are going to be single use, and I'll go through each of those one at a time. As we are assembling it, we are going to start with the spirette, which is the piece that the person puts into their mouth. And this piece is going to be used in addition, possibly with an airflow filter. And this filter is a component that will help prevent anything from being sprayed during an exhale activity. So the spirette, the connector, and the filter can all be used as a single use per activity and then disposed of. And I'll give you a demonstration of how this is assembled. So here is the body of the spirometer, and we are going to take the spirette, which is the piece that goes into the patient's mouth, open it, insert it into the spirometer, and you will notice that the spirometer and the spirette both have a little triangle that's intended to be matched up here. And again, it's best to keep the plastic on for the purpose of being able to do the insertion, right? And then for the other pieces, this is the filter, and here is the plastic connector. If you remove the filter from its plastic wrap, save the wrap because we'll be using it later for the purpose of being able to prepare the sensor for each activity. Here's the filter as well as the connector. And you will see that one end, the wider end of the plastic connector gets inserted here. Make sure you insert it quite firmly or else this will disconnect during the course of the activity. And then it gets inserted onto the back end of the spirette. Make sure when you insert it that you do not allow the spirette to separate. If you do, just kind of reinsert it. And that is how we prepare the spirometer for use. So we're going to begin with the introduction, and the introduction allows us to be able to gauge what levels would be appropriate with regards to each specific activity. The introduction mode has two components. The first component is the airflow sensor orientation, which is an opportunity for the patient to get used to breathing in and out of the spirometer and being able to see their breath and their breathing correlate with the movement of a line on a graph. But what I'm going to demonstrate for you now is what's called the pre-exercise warm-up, which is the opportunity to be able to do that assessment that will help you gauge the level that's appropriate for each specific activity. With the beginning of the activity, we prepare the sensor, which I'll demonstrate in a moment, but it's the process of blocking off the airflow using the plastic wrap to help make sure that there's no flow during the preparation or calibration phase. This is what the airflow sensor orientation would look like. And then we'll move on to the pre-exercise warm-up activity. Okay, so from the introduction, we're going to choose pre-exercise warm-up. We're going to prepare the sensor, which is again covering it with plastic, and then clicking prepare. It begins to hum to let you know that it's ready to be used. The next step is we go through the instructions for doing the pre-exercise warm-up properly. And for that, the patient should be sitting upright in a chair, have feet flat on the floor, legs uncrossed, with upright posture and head in neutral position. The patient will be placing the sensor, the airflow sensor, in his or her mouth with lips closed firmly around the mouthpiece and breathe normally. At that point, you will press start trial, instruct the patient to breathe in as deeply and fully as they can. After they've fully inhaled, they're going to blow out the air as hard and as fast as they can until no more air can be expelled, okay? Maintaining an upright posture throughout the activity. Once the air is fully expelled, you're going to instruct the patient to breathe in deeply and fully again, and that will end the trial. And then you will see the results of the trial under trial 1, trial 2, and trial 3. The 4 elements that we're going to be measuring for this are going to be maximum inspiratory flow level, maximum expiratory flow level, maximum inspiratory volume level, and maximum expiratory volume level. All levels are on a graded system between 0 and 25, 25 being the high end of normal and 0 being 0. Okay, and so once we get to the end of 3 trials, we'll be able to see their best performance under the maximum and then their average for the trials. If we have a bad result, we can also delete that trial and then restart. Okay, so I will now demonstrate how the performance will go. Okay. And that's the conclusion of the first trial. And you see my levels for each. I will continue on. Second trial and the last trial. And there you can see the results, at which point you would make note of either the maximum or average, and for each of the categories, and those will guide you towards setting appropriate levels for each of the activities that follows. Now, I will be making a transition from the presentation to the actual start of the exercise. We're going to be looking at the activity Diamond Mine. And to get there, the first step is to click on Start Single Exercise, and then you'll select Diamond Mine. Diamond Mine has several preset levels of difficulty from easy, moderate, hard, as well as the option to customize. The purpose of this exercise is to be able to develop inspiratory muscle power as well as to increase vital capacity. The concept here is that the patient is going to be represented by a vacuum cleaner. That vacuum cleaner will suck in all of the coins and gems, and you will be setting a volume target with regards to how much air that person will be breathing in. And that volume target will be represented by the diamond. So the goal is for that person to be able to inhale slow and steady to be able to get to the diamond for that complete execution of the activity. And then you'll be setting number of repetitions and again, some of the other parameters. And again, the purpose here is to be able to improve diaphragmatic breathing as well as strength, and to increase the lung volume capacity, to improve endurance, improve functional tolerance, self-care, respiratory, swallow coordination, sustained speech production of words and phrases. The first demonstration will include the simple volume only component of exercise. We're going to select Diamond Mine. I'm going to select the easy preset, as that will be the volume only parameter. You can see the parameters on the right here. And we will click Start Exercise, in which case I will be prompted to prepare the sensor. Again, cover it with plastic. Make sure it is not in the patient's mouth. That is definitely a problem with calibration. And then once it has calibrated, you'll hear it humming to indicate it's ready. And again, the patient is represented by the vacuum, and the coins and the gems are laid out. The target volume that you've set based upon possibly the results of the pre-exercise warm-up would represent the diamond. So if I can inhale to the target level that's been set in terms of the maximum volume, I will get to the diamond. We may cue the patient to fully exhale before inhaling to be able to get the best response. Initially doing this exercise may be wise not to go to the person's maximum volume as revealed through the pre-exercise warm-up, just because it may make a person lightheaded when they're not accustomed to the activity. So you may set it a little bit below the level that shows on the pre-exercise warm-up at the beginning. There's a summary that's displayed for the patient at the end of the activity relative to the goals that you set. And then as you close out, we will transition over to the outcomes of the exercise session. And what we'll see on the summary screen is you will see the best level, which in this case was level 15. And then you will see the average level. So the best level is represented by the green bar, and it says 15.27. The average level for the 5 repetitions for that set was 11.98. So that's kind of the summary, that all of this will get stored in the patient history. If we wanted to be able to evaluate the outcomes per repetition, I click on outcomes per repetition, and now I can see how the patient did across the set. So as you can see on my second repetition, I did not get a good breath, so I was not able to achieve the levels that had been targeted. But you can then look and see how a person is doing across the various repetitions of that set. In addition to that, I can click on the loops, and the loops will show me what the flow volume loop or curve is for that specific repetition. And you can use that to be able to assess the quality of the breath and the intensity. We can also evaluate or review the parameters that we had set. And if there were any comments during the activity, then you can enter them here, so you can be able to keep them as a reference for a future review. And finally, I should mention that you can generate a QR code by clicking on this button here, and that will allow you to scan and save the results into the AC Plus app. I'm going to demonstrate how you can select parameters if you choose to use the edit parameters function as opposed to the presets. And with that, I will also demonstrate how you can apply control levels that will help ensure that the patient is inhaling at a slow and steady rate as opposed to doing a maximum forceful inhale. The first volume only activity tends to encourage a maximum force without regulating the flow. To regulate the flow, we would click on the option of being able to edit parameters. And from there, we can click on the option of either exceed a minimum threshold or control flow. And the minimum threshold ensures that a person gets above a certain preset minimum that you would select. So the minimum is going to be set on this bar above. This is minimum inspiratory flow threshold. And then if you click on control flow, you can also set a maximum inspiratory flow threshold, and then you'll click confirm. I'm going to now demonstrate how you can apply specific thresholds for inspiratory flow rate using DiamondMind. To do this, you can click on the edit parameters button. And from here, you can, again, adjust the number of sets, the time between repetitions. But instead of just doing volume only, as we had pre-selected for the easy setting, I can check on exceed minimum threshold, which will allow me to set a minimum inspiratory threshold the person must exceed before they'll be able to start collecting the coins and gems. Or I can select control flow, and control flow will set both a minimum as well as a maximum inspiratory flow level. Okay, this creates a window so that we can really regulate and control how quickly or how slowly the person breathes in during the activity. The closer together these two settings are, the more difficult it will be. And we also still set a target volume level for the patient up here. This is a much more challenging activity. The stalactite and the stalagmite represent those control parameters that we've set. As I inhale in, I will move the vacuum to that central location so I'm able to bring in the coins and gems. Fully exhale my air. This last repetition, I'll demonstrate what happens if I breathe in too hard. Prehistoric contest is an activity that's geared towards being able to do a forceful expiration. We select it by clicking Start Single Exercise and then select Prehistoric Contest. You have multiple presets available for easy, moderate, and hard, which vary the number of sets, the number of repetitions per set, as well as the target flow level, which is the maximum expiratory flow level. The goal here is to be able to increase expiratory muscle power, as well as being able to help facilitate improvement with regards to airway clearance. So what happens is the patient will take a deep breath in, and then as they exhale, it will cause a javelin to launch through space and travel down a path. And the path has several targets on it. And each target is represented by a prehistoric animal. And the further down the path, the larger the animal. The ultimate goal is the woolly mammoth. And the woolly mammoth would represent the target that you set with regards to expiratory flow level for that patient. And again, the expiratory flow level can be derived from the pre-exercise warm-up with regards to what would be an appropriate target for the patient. This will help improve airway protection during swallowing, coughing, and clearing the airway, as well as the ability to increase intensity and loudness during phonation. All right, I'm going to select the easy preset. Start the exercise, which will cue me to prepare the sensor. Place the plastic over the sensor, click Prepare Sensor. I hear it hum, so I know it's ready for use. And my cue to the patient is to take a deep breath and exhale as hard and as fast as you can. I hit the target. That was not a good inhale prior to the exhale. It's better. the end of the activity, there's a summary for the patient with regards to their outcomes. And then we have the actual summary page, which we'll save in the patient history, which includes the summary screen, which shows the peak flow level represented by the green bar on this page, which is 4.67 for this activity, and the average performance across the repetitions, which is represented by the blue bar and is 2.99. If I want to see the individual repetitions, I can visualize them by clicking outcomes per repetition, and that will show me, again, the peak expiratory flow level for each repetition. The loops allow me to visualize on a flow volume curve those exhales. The parameters remind me as to what had been set based upon the preset, which was the easy preset. And finally, I can add any comments with regards to that activity or view them afterwards with regards to how the patient performed or tolerated the activity. And if I click generate a QR code, it will allow me to scan this code directly into AC+. The next activity is sail away. And sail away is an activity intended to control the rate or flow of air during an expiration activity. Okay, so the concept here is that we're going to, again, regulate both the volume as a target as well as the flow rate. And in this case, the flow, our intention is to be able to set levels that are challenging because they require the patient to control breath and not do maximum exhale. Okay, the patient is represented by a cloud, and the sailboat will move across a body of water propelled by the breath of the patient from the cloud. Okay, the concept for this exercise is that we are going to use it to help a person fully exhale in order to be able to help reduce the amount of carbon dioxide in their system, as well as to regulate dyspnea. It can have a calming effect on the patient to do slow, sustained exhale activities. It allows for eccentric control of the diaphragm and to slow the pace of breathing. And its applications would be to help improve phonation, sustained phonation, voice intensity, as well as speech intelligibility. The volume that we're going to be setting is the distance of the water, body of water that the sailboat must cross. There will be indicators mid-flow, which is at 25% and 75%. And then the island represents successful completion. There is a flow rate indicator below the cloud, and that will help demonstrate whether the person is getting close to or exceeding the flow thresholds that we've set. So the indicator would be green or yellow if we are in good tolerable limits, but will turn to red if we are approaching that threshold that we don't want the patient to exceed. And if it does exceed, then it will effectively cause the sailboat to stop. And you will get a message on the screen saying you exhaled too hard. Select sail away. I'm going to take the easy preset. Prepare the sensor, blocking with a piece of plastic. Prepare. And the instructions to the patient are to inhale through the nose and exhale slow and steady through the mouth. I will demonstrate breathing at too fast a rate, too high a rate, after the rest process is complete. I didn't. I exhaled too hard, so a cue to slow down the next time. the conclusion, I get the results displayed for the patient with regards to numbers achieved, the results 1 exhale too hard, and 91% towards target volume on 5 attempts. Looking at the outcomes that will be saved in the patient history, we again have the summary of outcomes, which represents both their best volume level with regards to their exhale and their average over the course of the multiple repetitions. I can click on outcomes per repetition to be able to see the expiratory volume levels per rep, as well as their average expiratory flow level below that. Okay, and you can see that on the 3rd repetition, I had increased the flow rate to a high enough level that it triggered the threshold and ended that repetition. In addition, we have the option of viewing the loop with regards to per repetition, reviewing the parameters that we had set, as well as any comments that we make relative to the execution of the activity. And then I have the ability to generate a QR code for export of the information into AC+. If I wish to edit the parameters, I can enter the edit parameters function. And for this activity, again, I can adjust the number of sets that I'm performing, the number of repetitions per set, the time between repetitions, the target volume, which can be according to what you see from the pre-exercise warm-up, and then the maximum expiratory flow threshold is that control component. The higher I set this, the lower the threshold is in terms of how much air it will tolerate before it breaks the sail. Okay, so this is the easy setting on the left side of this spectrum. This would be the more difficult setting on the right side. We are now going to review the Starry Road activity. Starry Road is an exercise intended to help establish a rhythm of the breathing cycle. And again, it can be selected based upon presets for easy, moderate, hard, or customize. Our concept here is that we're going to be trying to establish a rhythm of breathing based upon the duration of inspiratory and expiratory cycles of breath. In addition, we can adjust the volume, the target volume, which will affect the height of the path. This activity is represented by a figure holding an umbrella, and the inhale and exhale controls the descent and ascent along this pathway. And the goal is to stay on the path to be able to catch each of the stars on the path. The height of the path is determined by the volume, the slope dependent upon the settings for the duration of inhale and exhale. And our purpose here is to be able to help regulate the breathing rhythm. So it's good for people who have dyspnea, right? Irregular breathing rhythm. Stress and anxiety may also be well suited for this activity. By improving the rhythm of breath, we can also help retrain respiration swallow cycle, improve sustained phonation, vocal intensity, and speech intelligibility. I'm going to demonstrate the Starry Road activity, and I start by selecting Start Single Exercise. Starry Road. And then I can choose from several presets, easy, moderate, or hard. The presets adjust the number of sets, the number of repetitions per set, as well as the target volume that we set. In this activity, we also set targets with regards to the inspiration duration and expiration duration. But the easy preset pre-selects those. The purpose of this activity is to be able to establish a rhythm for inspiration and expiration. And our goal is we can adjust the path height to represent the volume of air that we're looking for that patient to take in with each breath cycle, right? And the path slope is going to represent the duration of inspiration and expiration, which we can set separately. The concept here is we have a character who is floating on an umbrella along the path, and they will inhale and exhale in order to ascend and descend. The goal is to stay on the path and to capture each of the stars on the path. If they breathe in too quickly, then they will stray from the path and lose those points. The purpose of this activity is to be able to establish better rhythm of breathing. Rhythmic breathing can be valuable for a variety of physiological parameters, including adjustments of heart rate and blood pressure. It can also be valuable for moderating autonomic nervous system activity, so for reduction of pain, management of anxiety or stress. This type of rhythmic breathing activity is valuable for retraining the respiration swallow cycle, improving sustained phonation, vocal intensity, and speech intelligibility. This is one activity, by the way, where you can adjust the parameters mid-activity, and I'll demonstrate that. Okay, select Starry Road, and I will select the easy preset. Start. Cover the filter and click Prepare. This barometer hums to let me know that it's ready to begin the activity. My instructions to the patient are to breathe out to make the figure float down, breathe in to make the figure float up. I missed the path. This may be challenging for me, so I can actually go up and adjust by clicking the button at the top of the screen. Which will allow me to make adjustments to the volume levels, inspiration and expiration cycles, and then I can resume the activity. Patient gets a percentage score based upon their conformance with the path at the end of the activity. And then we are able to see their results. The summary gives again their percentage of compliance, but the outcomes per repetition allow us to see what their expiratory volume was per breath cycle, right? As well as what their expiratory flow level was per breath cycle. We can see the inspiratory and expiratory components of their breath on the flow volume loop. We can view our parameters that had been pre-selected in this case on the easy setting and insert any comments we have with regards to that activity in terms of patient performance, tolerance, or correlation with outcome measures. And we can then generate a QR code, which allows for the data to be exported directly into AC+. If I would like to edit the parameters, I enter the Edit Parameters function. And from here, I can adjust the number of sets, the number of repetitions per set, the target volume, which allows me to adjust it specifically to the individual needs of that person, maybe based upon the results of their pre-exercise warm-up. Realize that they'll have to hit that level for each repetition. And so with many repetitions, it may be difficult if you set the levels too high for the maximum volume. Here I can adjust the duration of the inspiratory cycle. I have it set now at 2.5 seconds, and I can also set the duration of the expiratory cycle separately. And here I have it set at 5 seconds. I can also adjust the path width, which makes it easier or more difficult with a narrow setting. And I could adjust it so that I have expiration only. I have pause between each repetition on, but I can turn that off. The path can adapt based upon the degree of success that the patient has during the activity. And finally, if desired, I can switch the visual representation so that instead of the exhale resulting in a descent and the inhale resulting in an ascent, it will switch it, and the exhale will result in the figure moving up, inhale, and the figure moving down. The dandelion is an activity that allows for several different types of exercise combined into a single activity. And it replicates the exercises that are part of the active cycle of breathing technique. And the active cycle of breathing technique effectively has 3 phases. The first phase is breathing control, which is a slow and not deep, but with focus on relaxation of the upper chest and breathing into the stomach or the diaphragm breathing, okay, for the first phase, which is breathing control. The second phase is lateral thoracic expansion. And for that, we're trying to now increase the depth of inspiration, as well as to be able to get expansion of the lower rib cage, and then to hold at the end of that breath before doing a slow exhale. And the third phase is a huff technique. And the huff technique allows us to be able to get the air which has been breathed in to help push out any secretions that might be lining the airway. And the idea is to keep the throat open. So unlike a cough where we close our throat and breathe out forcefully, we keep the throat open and just huff the air through and try to get, again, those secretions to mobilize as a result. The first 2 phases of the activity are going to be open-ended with regards to the number of repetitions and duration, so that you will select when the patient progresses from breathing control to thoracic expansion and then on to the huff technique. And the purpose here of this activity is to be able to promote airway clearance, improved aerobic capacity and muscle endurance, for improved ability to perform functional tasks, self-care, as well as improved respiratory swallow coordination. The active cycle of breathing technique has been well demonstrated through clinical trials as a effective method with regards to being able to help facilitate airway clearance. And again, the therapist will designate how much of each portion of activity will be put together into the single activity. Phase 1 typically will allow for the patient to practice doing the rhythmic breathing, the breathing control phase, for 10 to 20 seconds. And then moving on to phase 2 by clicking the Start Thoracic Expansion button in the lower right-hand side of the screen. And phase 2 allows us to increase the inspiration phase and try to get more expansion of the lower rib cage into the stomach and lower rib cage. And then moving on to phase 3, which is the huff technique. I'll now demonstrate how those look. I am going to use the easy preset for the demonstration. Click Start. Prepare the sensor by covering with the plastic shield. I will hear the sensor hum to indicate that it's prepared for use. The instructions are on the screen. Breathe in and out gently for 10 to 20 seconds while keeping your upper chest and shoulders relaxed. Repeat this for 10 to 20 seconds, and they will just simply see the dandelion sway with each breath. When I'm ready to progress to the next phase, click Start Thoracic Expansion. And the instructions are now to take a deep breath in, fill the lungs, hold for 2 to 3 seconds, and then slowly exhale out, and repeat that 3 times. Hold. When I'm ready to move on to the huff technique, click Start Huff Technique, where I have the option of going back to breathing control phase if I want to repeat that. With the Huff Technique now, my goal is to be able to breathe out forcefully enough to blow the seeds off the dandelion. The more forceful my breath out and more sustained, the further the seeds will travel. There's a flow indicator below the dandelion to demonstrate what my peak flow is. It's both the force as well as the sustained exhale that will affect the dandelion seeds traveling. At the conclusion of the activity, I can see the summary results, which will show me the highest expiratory flow level. And I had 9.55 with an average expiratory flow level of 6. If I look per repetition, however, I can see both the peak expiratory flow level per repetition, as well as the duration of each exhale. And then I'm able to visualize that in the context of the flow volume loop. I can review the parameters that were part of the easy preset, which is what I had selected. And I can put any comments in here with regards to the patient response or tolerance. And then finally, I can generate a QR code to be able to export the data directly into AC+. If I wish to edit the parameters, I can enter the edit parameter function, and you can see that I can adjust the number of repetitions. If I wanted to add an inspiratory hold to the activity to make it a clear cue for the patient, as a matter of fact, a requirement, a prerequisite, I can click inspiratory hold enabled, and then I can set how many seconds I'd like that inspiratory hold to be, right? And then in addition, I can set the threshold level, which is a control mechanism with regards to how forcefully the person exhales. If they breathe out too forcefully relative to the threshold that I set, it will snap the dandelion. Okay, so the left side here is an easier setting. If I move the indicator over towards the right, it's more sensitive, it's a lower threshold, and therefore it's a more difficult setting.